Happy Wednesday. Welcome to Lunch with the Doc.
Right on time once again.
Yes, here we are at La Serena in South Laguna. We did our first Lunch with the Doc at South Laguna in town, and we thought,
At South Laguna in town?
Sorry, at La Serena in town.
I'm right in a
today
parking
we
spot.
thought, hey, let's come to the one in Solot because this one's amazing and awesome.
There's a lot more room to eat here. They have a full-on working bar with beer and wine and healthy margaritas if you like those kind of things, and then a lot more seating area for your family dining. They have great food. They have grass-fed beef, gluten-free options. It's an awesome place to eat. Everybody knows La Serena in town, which means the Mermaid. So
What'd you get?
Today I got the bowl of chicken tortilla soup. Since I'm both gluten and corn-free, I got it without the tortilla chips on it, but with a little bit of cheese and a little bit of guacamole.
Oh,
What'd you get?
I got this salmon taco with no corn tortilla and guac added. What did you get behind the camera, Raya?
Yeah,
I got steak nachos.
Oh,
What
that's
up?
my
That's my
favorite.
favorite.
steak nachos are amazing. I mean, when I used to eat, those were considered, in my book, the best nachos on the planet.
Yep.
These
I
steak
think
nachos.
I still consider it to be the steak
Yep.
best.
Yeah.
All right, so we got a number, 45.
Yeah, number 45.
We're
All
gonna
right.
go sit down. And look, we brought a whole bunch of fun props and like goodies for you guys today. How good is that?
We have some really good tips and info to share with you today.
Look at that
so
car behind us.
we are
too.
excited. Yeah,
Yeah, like what kind of car is that, really?
A cool car. Spicy car.
really.
It looks like it's a Mercedes with a...
It's a Buick.
That's his Cadillac. I don't know what it is. It says Cadillac.
It's Frankenstein.
It says Lincoln. It's got all kinds of different makes and models on it. That's a unique ride.
That is a unique car. We
So
like it.
Frankenstein.
What we wanted to do is we wanted to talk today about one of the most common health problems there is, which is disc problems. I don't know one person that's probably 21 or older that doesn't know someone or themselves has had a disc problem. Either a degenerative disc or a disc herniation or a disc bulge that has either required surgery or epidurals or prednisone called a Medrol pack or chiropractic adjustments or spinal decompression or acupuncture. It's a very, very, very common problem. And what I thought I would do is speak from my experience. This has been 30 years now, since 1987, of working on people's bodies, and we find that the disc problems are one of the most common problems. So, and then I myself had a disc herniation in 1997. Mine was a really bad one. It was a 7mm disc herniation that was 19 millimeters wide. My MRI report was right here, and I don't mind sharing it because when you come through something yourself and you get through it without having surgery, then it gives you, here, check this out right here. Zero in right down there, right? L5S1, 7mm disc protrusion by 19 millimeters. So it was really big, and then I had two bulges on the other one, 1997. So what are we really talking about here?
What does that mean when it says disc bulge?
Disc bulge. What it means is that you have a normal disc. I'll get out my little bag of props.
He's got some good props today. He's a Mr. Scientist.
Well,
He's feeling proppy.
Everybody that's watching basketball, if you're a basketball fan, you know right now that Steve Kerr, the coach of the Golden State Warriors,
Dope.
yeah, really great coach, but he's had nothing but back problems and complications from back surgeries. Now, I know some of the finest surgeons in Orange County, and I won't, there's a lot of good surgeons, and there's a time and a place for surgery. and I know some really good doctors that also do epidurals, those kind of things.
Thanks,
But
brother.
the idea is to try to avoid having to take medications and getting surgeries and epidurals if you can help it. But what Steve Kerr's problem was is he went ahead and had to have surgery, but he had complications. He had a leakage of the spinal canal, and he was on CNN, I guess last week or a week and a half ago, and he said, whatever you do, don't get back surgery if you can help it. Now that doesn't mean all back surgeries go bad, because a lot of them are really good, and a lot of people are really good after those surgeries. But he was one of those guys with complications who had problems afterwards, so he was, wishing that he hadn't got back surgery. Now, whether conservative care could have done it for him or not, I have no idea. For me, I didn't need
your water, Mom?
I didn't need back surgery, and I didn't need to have an epidural. All right, let's just talk about the basics here. All right, here is a plastic spine. Now the spine actually has normal curvatures. These are your discs right here. These are the discs, and they're like spacers, and they're made of cartilage, and they're also like sponges. They fill up with water when you're sleeping. So when you're sleeping like this at night, then they fill up with water, and so you got to be hydrated. When you stand up and you're upright for the day, then slowly that water and hydration starts to decrease. Could you get me a water too, babe?
We can share.
All right, sure. Thank you. Here's talking about getting hydrated and keeping your discs hydrated.
Stay hydrated.
So these are the vertebrae. These are the discs. These are the spinal nerves. This is the base of your skull right here. The brain is the generator of all this electrical energy. It sends it down through the spine, and then the power, the electricity comes out these spinal nerve roots to every single muscle, every organ, every tissue, every body part gets its life force from the brain. It's a generator. A guy won a Nobel Prize. His name was Dr. Roger Sperry. And what he found was that 90% of the energy that the brain, that's a generator, 90% of the energy of that brain goes down through, and it's used to just hold our body in relation to gravity. So sitting here, standing, walking, talking, those are all just gravitational forces. That's what 90% of the energy's body is used for. He won a Nobel Prize. Only 10% has to do with thinking and healing and your metabolic rate and your organ function. Only 10%. Now that's if you have normal posture, meaning that there are certain curvatures of the spine. If you have normal postures, then 90% will go to working with gravity, 10% for organ function. If you have distortions of your posture, let's say you've had a trauma and you had a whiplash and your head went forwards and backwards, and now your curve of your neck, you've lost it and your head is forward from where it's supposed to be, that means you're going to rob part of that significant 10%, which is for healing and metabolism and thinking. You're going to rob part of that precious 10% just to deal with a distortion. That's why all the research that's coming out now having to do with posture shows if you fix your posture, you fix so many other things, because it's so important. 90% of your energy goes to it. So that's the basics. Now here's with a low back disc herniation. This is the most common one.
Look at us. Look at it. Look at it.
Oh, here comes the food. Here comes the food.
Oh, here's the man.
Amazing.
Chicken,
Oh, the bounty is real.
yeah, and I had a salmon.
Thank you.
What's your name, man?
My name is Miguel.
Thanks, dude.
Yes.
Appreciate it.
Okay, and I'm carne asada nachos.
Yes.
Alright, this is natin sila na meron.
Savior of hunger.
Awesome. Thank you so much.
Mo, are you happy?
I am so happy. Look at that salmon.
Are you happy?
Aioli.
Look at that soup.
Oh yeah.
Oh yeah, with guacamole.
Yes.
All right, so this is the most common disc to be injured, like mine was on the MRI. This is what a big disc herniation looks like. It
Okay.
pushes pressure in on the nerve there. And the most common thing I find with people that end up getting a low back disc herniation, they could just be bending over to tie their shoe, and then blam, it happens, or to pick up a sock or something like that. Sometimes it happens so easily. But what I find is that one thing everybody shares in common that has a disc problem, usually their sacroiliac joints, which are the biggest joints right here. That's where you feel that little dimple back here. That joint is supposed to move every time you walk. That joint is supposed to move 100% like this. Usually what happens is that these joints get locked, and then these discs have more pressure on them than what they're supposed to have. And so mechanically, you're asking these discs to do more than they should. And so when they move more than they should, they can tear and herniate. So what is that? Well, here's a normal disc right here. Let's see, this one. So there's a normal disc, there's your spinal cord. There's the big hole where the nerve comes out. That's normal. Big healthy disc, beautiful bone. This is a disc bulge right here, a bulge disc. Usually when I order an MRI, I've ordered over 7,000 MRIs, and I've only had 13 of them come back that said normal. So when I do an exam, when somebody tells me that they have pain, it increases sometimes when they're coughing or having a bowel movement, or when they bear down, or when they sit for a long period of time, or they have sciatica, or they have pain in the neck that radiates down into here, or numbness or tingling down to the arms or hands, or they wake up at night with numbness and tingling, or numbness and tingling in their feet, or pain down the leg. My first disc herniation case was one of my best friends, Dave King, and he's the godfather of my kids. He's from Santa Cruz. Dave, I hope you're watching. The only pain he had was in his calf. He had no low back pain, but he had pain in his calf, and when I had him when he bared down like this, he felt pain in his calf. I went, let's get an MRI. He had a huge disc herniation, and so this is a bulge. Now the next stage past the bulge is called a herniation. That's where the nucleus, which is right here, the bulge loosens, and this annulus, which is the protective membrane around, it's called an annular tear. This is where the nucleus pushes back and now puts pressure on the nerve. This is an extrusion. But what you'll also notice is that the disc is degenerating and bone spurs are starting to grow. That's arthritis. And then this is severe. This is severe arthritis, degenerative arthritis, or osteoarthritis. This is where the disc is degenerating, the bone spurs are growing, and now the spinal canal, which should be big where your spinal cord comes through, now it starts to grow down on the spinal cord. Whoa. And then these holes here start to grow in with bone spurs.
Wow.
Now the reason bone spurs grow is because of abnormal posture. You don't have the normal curves of your spine, and because there's scar tissue all around these segments, and if joints don't move, they start to fuse. That's how arthritis happens.
Interesting.
And bone spurs start to grow. So that's a disc herniation, a disc extrusion. There's the disc bulge right here that I showed you. And then there's normal. So that's a lot of information about discs. Hopefully this gives you a little bit better idea of how disc problems happen. This is a normal disc. This is a disc herniation here. This is like a pinched nerve where just the vertebra rotates out of place. These are much easier to fix. What we do at our clinic is we work with the orthopedists and neurologists. If conservative methods that we use, we do a combination of care that's 97% effective. If I accept a case, 97% of the time, we can fix these discs and get them so that they calm down and people's pain goes away. What we do is a combination of therapies. We use soft tissue work to loosen up all the scar tissue. We use a technique called Graston, which is to loosen up scar tissue. We use the deep muscle stimulator, which is a massage device which helps to loosen up muscle spasm. We use the active release technique, or ART, deep muscle therapy. We use nutritional protocols, and also decompression. What decompression does is we have a table that basically we find out on the MRI where the disc bulge is, and then the decompression actually opens up that space and sucks that disc membrane back in off of the nerve. So the decompression therapy is for a disc bulge, a disc herniation, or even for arthritic joints like this in the spine to keep them from fusing. Because once it fuses, I can't help it get back to where it should be. Yeah, go ahead.
Well, questions out there for the audience. If you have questions along the way, ask them. As we're talking about disc bulges, questions about, what those things mean or anything like that, ask away. Just type in your little comment and we can answer it. All right, continue.
Mom told me it wasn't polite to talk with your mouth full.
Oh, yeah. No, we don't want to do that. So you said you have put about 7,000 orders in for MRIs and only 13 have come back normal. So every other person has had a disc problem.
Right.
Wow, that's a
That
lot.
it shows on there.
I heard that 1 in 3 males in America have a disc issue.
Yep, it says 4 out of 5 Americans will have low back pain
Wow.
at some point in time, and commonly it's from the disc. And commonly it's just because, California OSHA said that the average little kid, by the time he's reached his 6th birthday, they've fallen off the diaper changing table. They've fallen off their bike. They've fallen off the monkey bars. They went on a toboggan ride, whacked this way, and snow ski, water ski, snowboarding. You name it, car accidents, diving into the bottom of the swimming pool, falling off the ladder, falling off the slide, falling off the swing. I mean, you name it. California OSHA says that the average 6-year-old boy has had 2,000 traumas of some sort. I'm sorry, I said 2,000. I meant 200. 200 significant traumas. That's an average of about 1 every 10 days. So if you're a mom watching this, think back to your infant son and think about how many times they fell off of this and tweaked this, and if they had a big brother, they help them get more traumas because the big brother gets them in a headlock or trips them or does whatever. Yeah. So
Ryan was a good big brother. He didn't do any of that to us.
That's not true.
but layer after layer of traumas, our body gets inflamed when you get a trauma, and then beginning the 5th day, your body starts laying down scar tissue to repair the injured trauma. And in that repair process, your body lays down scar tissue for the next 12 weeks. So layer upon layer upon layer of trauma we all go through. I mean, I think about what I put my mom through with all my injuries as a little guy. No wonder I had disc problems later on. So it's just that the tissue heals with scar tissue that's not very flexible, and when it tightens down, it throws off the posture from normal. And our X-ray software, we can tell to 1/10 of a degree and 1/10 of a millimeter how far you vary from what the normal research says your body's supposed to look like. Good news is you can fix a lot of this stuff. You can fix your posture so you don't get disc problems. So let's just talk about some basic things you can do to avoid having this happen.
Yeah, some advice for all the viewers out there. What can you do in your daily life?
Number 1, stay hydrated.
Yes.
Drink a half ounce of water for every pound of body weight. So if you're a 120-pound woman, you need 60 ounces of water on a daily basis. Some people put a little bit of organic lime or lemon in it, not too much so it messes with the enamel of your teeth, but a little bit is good. It makes it taste better.
You know what's actually the best thing to use is essential oil. Lemon, because it doesn't have that much acid for your teeth,
Right.
and it's made from the peel
Okay.
of the lemon.
We also use a little bit of mint chlorophyll in our office. You can use chlorophyll as well. So stay hydrated. Number 2, get enough sleep. Number 3, you monitor your stress. If you're under a lot of stress, that creates a lot of cortisol. Cortisol is inflammatory. That creates more inflammation in the body. And if you've already got mechanical challenges, like postural distortions, wherever you have more inflammation, you're going to have more problems potentially there. Number 4 is get checked for your posture. Have postural films done. Some people are concerned about the X-ray. I mean, the new technology, it's getting a whole postural series of X-rays is about the same amount of radiation as you get flying from here to Chicago. So it's not really an issue anymore. And then get your range of motion checked. Then from there you can do specific exercises that are specific to your body. So you're doing, if you're distorted this way, then you do exercises to strengthen this side and loosen this side. So it has gotten very specific. You know, the first 20 years it was more generalized. Now it's gotten to be very, very specific, so you know exactly what you're doing, what you need to do for your body to help fix it. So
what would you say maybe are some of the best types of exercise for, you know, low back pain and healthy body?
Yoga's great. Also, I would say doing basic flexibility exercises like knee to your chest, bringing it, you know, your knee to this chest and do about 6 deep breaths. 6 deep breaths, pulling it over to this shoulder, 6 deep breaths, pulling it over to the floor on that side. Grabbing a doorknob and getting down low. It's called the doorknob stretch. Getting down low and breathing. Those help to open up the low back. Some of the inversion components, I mean, some people get the inversion tables, and those are nice. It helps to open up your low back. But there's something called an invertrack. If you look online, invertrack.com, you'll see you hang upside down, but you can do crunches and extensions and twists and exercises to strengthen your core and do some decompression. And these are all things we can recommend to people that you know, either want to treat a low back disc problem, they want to avoid surgery. I have a patient right now whose MRI shows he's got a lot of arthritis, a big disc herniation, and he does not want to get surgery. So we're putting together a plan of care to see if we can help him avoid getting surgery. And then when we put that plan of care together, we have checkpoints. So every 10 visits we check and we make sure, is he getting better? Is he getting better? Is he getting better? Is it worthwhile? Is it a worthwhile investment? And are we getting a return on that investment? So, you know, that's how we approach them. The other things is glucosamine, sulfate, minerals, magnesium helps to keep your body from getting too tight. Calcium does this, magnesium does that. So make sure your magnesium levels are up. Taking fish oils is really good. Make sure that you get a fish oil that says molecularly distilled. That means it won't have PCBs and heavy metals in the fish oil. You know, Pilates, yoga, core training, core exercise, all that stuff.
Yeah.
Yeah. And then for a neck one, what we do is we have a pump up collar that you put on and you pump it up, and it helps to open up and stretch that space where those discs are pushing back on the nerves, and that's part of the home care plans we put together.
That's good.
Yeah.
And probably also, you know, for people who are in the office all day, it's really important to get up and stretch every once in a while. And, you know, instead of inverting forward, trying to keep, you know, that chest up in that proper posture.
Yeah, when you're at your computer, try to keep, you know, raise up your TV monitor or your VGA monitor. Raise your monitor up so that it's looking straight ahead. You're not doing this.
I just did that today.
Yeah.
I put like something under it.
Oh, that's good.
Good.
I was looking
That
down
helps.
a little bit
Yeah.
too much.
So, I mean, hopefully this has helped
Yeah.
get some basic information. We always offer courtesy consultations if you have a health issue that you want to potentially see if you can get better. It's affecting your life and you want a better quality of life where you don't have pain and problems. I'd be happy to do a complimentary consultation for you. Come to one of our workshops or go to healthandbalance.com and get on the website, and you can click here to receive a complimentary consultation. We'd love to see you, love to help you. You know, started here in 1987, and now this is 2017, so we got 30 years of doing this work, and we got a great young doctor on board, Dr. Jordan Martin, who graduated from Laguna Beach High School, and now Dr. David Alapag is starting with us, and we have Dr. Marcela Dominguez, who's our medical director, Rochelle Rodriguez, who's our family nurse practitioner, Dirk and Michael, our massage and physical therapy team, Camila,
Your wife.
My wife, my favorite doctor, Dr. Lisa Arthur, thank you.
Yeah.
And so we're here for you. Love to help
And
you. Yeah.
On the
what's coming up?
21st, what's coming up here at Health and Balance? The 21st of this month, it's a Wednesday night, 6:30 p.m. We're doing our Lose the Weight, Summer's Looking Great workshop. It's going to be super fun. We already have spots being taken, so if you're interested, give us a call, and we will get you
What
a
is unique
spot
about this one?
reserved. Okay, so what it's going to be talking about is genetic weight loss and the benefits of that. And there's new technology out where we're able to do, it's just an easy thing where you take a little saliva scan and then, excuse me, they'll give you information on what is best for your specific genetic makeup, like what types of diet you should be eating, what types of exercise you should be doing, some different proclivities you might have with your genetics. So that's
What
gonna
kind of
be
results
awesome.
do people get with that?
People get about 300% better results, or 3 times better results doing this kind of genetic weight loss work rather than other conventional approaches. So it's been very helpful for lots of people. So come and learn about that on the 21st. And then from there we're going to be having,
Stem cells.
yeah,
I just got 30 million stem cells injected last week into an old shoulder injury where I dislocated my shoulder and tore up my AC joint. So I had 10 million put in here, 5 million put in my AC joint. I had 5 million put into my thumb. It's got some changes from 30 years of adjusting, and 10 million into my left hip because I don't want to have a hip replacement in that side. And been having fantastic results. So we have a stem cell workshop on September 27th. It'll be in the afternoon.
it might be on the 29th.
Oh, 29th. It'll be in the afternoon. We're serving lunch, so you can get a free spot in that workshop and just explain to you what the exciting new things that are happening in regenerative medicine, where we're seeing people not have to have joint replacements and things like that. So it's really awesome to see what's happening.
Super exciting. So we're stoked about that. We'll give you more info on that coming up, but we hope to see you at our workshop soon. We have a super summer series with a bunch of other workshops coming up, so stay tuned for all those ahead. And we hope you're enjoying your
Not sunny.
gloomy June.
Yeah.
But it's okay. Sun's coming, and we're just all excited that summer's around the corner. So,
Yep.
blessings. Have a good Wednesday. See
See
you
ya.
next week.